So we've been working on health for, 2 days. Unlike water, probably no two people in this room would agree on what health is. So that's a tough starting point. If you're a scientist, it's the absence of disease in a biomedical model. But I think a more acceptable definition is culturally constructed. What is health? So the future of health is a difficult thing. When we started looking at the probable futures of health, it's quite a dystopic picture, I think, that most of us come to for a couple of reasons. The first is that we derive health, however you define it, from our environment, which is often termed the wider determinants, and our health and care systems. Now, what most people outside the health system wouldn't realize is that's about an 80-20. So 80% of our health expectancy of our population is derived from wider determinants, and about 20% from the health and care sector. So that's the context in which we looked at desirable futures as well. Desirable futures are a little bit easier, and I'll tell you why here. So we got a bunch of questions, we brainstormed that, and then Anna led us through a process of putting them all on a chart in which we have low impact kind of questions if we answer them, and high impact, versus things we might be able to control, versus things that we couldn't control. And from that, we picked the ones that we liked, and then we voted on them. So there was no groupthink, we banged it all together. And so we've got our 3 questions from that process. Question number 1 that we need to answer for defining our probable futures, our desirable futures where we're going to go, is how do we reconnect people and the nature? Because we think in the wider determinants of things, that's probably the most important single thing that we can do. And it's also contiguous with the desire to make resilience an ecosystem type function. The second question is, how can we accelerate the uptake of best practice? So how do we implement these things at scale? And how do we do this quickly? And our third question is, how do we enable corporates to play a meaningful role? Now, we had a large debate about whether it was even possible for corporates to play a meaningful role in improving population health in a future where we're really struggling to build resilient communities because of the degraded environment that climate change and other problems are going to cause. The conflict of interest between the drive for profits and that motivation versus the desire of some to give back to the community. We don't know how that could be solved, but we do know that corporates are really key for a lot of aspects of population health. For example, they transport all the food to the markets. They provide transport services in urban environments, they build hospitals, they build railroads, etc., etc. So from those wider determinants, the things that keep us healthy, jobs, for example, healthy homes, we really do rely on corporates. How can we turn that around? We don't know, but that's our third question.
Thank you very much, Chris. Yes, thank you very much indeed. Just looking at this number 3, which is the second answer. How can we accelerate the uptake of best practices towards resilience? Are people clear what best practices towards resilience currently are? I'm not sure.
So we weren't referring to resilience, but best practice in terms of the development of an improvement for human health. In that context of resilient communities.
Okay. And also reconnecting people and communities with nature to build resilience. Can you explain the importance of reconnecting people and communities with nature? Why would that naturally build resilience?
Right, so the first problem is probably that we have major global degradation and climate change because we are disconnected from nature. We don't immediately feel the impact. We can protect ourselves by building a hospital, for example. The second aspect, I think, is that there are many qualities of nature which are health-giving. And I think it's widely regarded now for urban populations the single most important thing you can do is have a high-quality green space.
Thank you. Okay, you want to just... Okay.
I have a comment.
You've got so much going on.
I've just finished a big project on climate change and health, and so I have to really ask this question. Did you look at the impacts climate change will have on human health and thereby what needs to be done? For example, new diseases are coming out of permafrost melting. Vector-borne diseases are really newer strains are coming. So the medical practitioners and mental health because of the number of disasters people are facing. So the way in which the health sector or the health practitioners need to respond is going to be very different. Exactly how we talk about climate management and other things. So that's one question. The other which really intrigues me is that in your list, all the other questions you left out have the terminology health in them. But the ones that you've chosen don't have health in them. Is that a particular reason?
It's implied, because we're the health group. To answer your first question, we didn't delve greatly into the impact of climate change itself on health, but as a public health practitioner myself, I can tell you that the United States, Canada, and the United Kingdom lead the world in chronic disease. And as many problems as climate change may create, that's going to be a long-lasting goal. I believe almost every state in India now has made the epidemiologic transition from infectious disease morbidity and mortality to chronic disease. Our problem is chronic disease, and it's going to be chronic disease in the future.
Wonderful. Any final closing thoughts? Any good news? Not very much a cheer from Chris at table 4, but still, that was important stuff. Any further closing thoughts?
I have.
Yes.
Sorry, this was pretty important. We put it out on the table the first day, and that is inequality is probably the single most problem we have. And so we left it on the table because we could have spent the whole 2 days just talking about inequality. But there was almost no discussion that we had where at the end of it we didn't go, but what about the poorest or the most vulnerable groups? But sorry, that didn't come out in this conversation.
Chris, thank you very much. Round of applause to table 4. Thank you very much indeed. And that concludes the exercise for this afternoon, indeed for today. Where is Dominique? There you are. And we've still got about half of you here, which is good. The rest, some of you have drifted off. It's been a long day. Sorry for keeping you here for so long.